Okay, good morning. Welcome to our panelists and all of you who are joining us this morning for this National Apprenticeship Week webinar. Today is day 2, and our topic today is apprenticeships for non-traditional occupations. My name is Mike Conley. I'm a member of the Illinois Workforce Innovation Board and chair of its Apprenticeship Illinois Committee. I was a self-employed small businessman from 1990 to 2020. And I continue to operate along with my family a small town newspaper and coffee shop. For the past 2 years, I've become further immersed in the workforce system while working for an Illinois community college. I'm currently director of workforce development and career pathways for Southwestern Illinois College, where I seek to build bridges between education and training and employment. Apprenticeship as a mechanism for developing a loyal and well-trained workforce has been around since the Middle Ages, but up until the past several years, it's primarily been utilized in the United States by labor unions in the construction trades. And here in Illinois and across the nation, we're in the midst of an apprenticeship renaissance that is fueled in large part by the recognition that it's a workforce development tool that works equally well across many occupations that require concurrent classroom and experiential learning. We've seen a rise in apprenticeship in employment sectors as diverse as manufacturing, insurance and financial services, retail business and hospitality, healthcare, information technology, and even public sector occupations like firefighting, emergency medical services, and policing. So I'm pleased and honored today to have 3 panelists who have special understanding of how the foundations of apprenticeship stand up across employment sectors because of the strength of its principles, which are work-based learning and mentoring, related classroom instruction, wage increases for skills gains, and industry-recognized credentialing. Peter H. Velasquez, Doctor of Pharmacy, is the Executive Director Emeritus of the Accreditation Council for Pharmacy Education and a leader in developing pharmacy technician apprenticeships. He retired from ACPE in 2019 after 20 years of service and continues to serve as a consultant. Dr. Velasquez earned his Bachelor of Science and Doctor of Pharmacy degrees from Philadelphia College of Pharmacy and Science and served his residency in hospital pharmacy at Thomas Jefferson University Hospital in Philadelphia. His professional experiences included service as a clinical faculty member at the Ohio State University College of Pharmacy and PCPS, as well as a research associate professor of medicine and pharmacology at Jefferson Medical College in Philadelphia. Dr. Velasquez is a founding member, fellow, and past president of the American College of Clinical Pharmacy. Payton Drury is the Human Resources Director for the city of Collinsville, Illinois, where she strives to create meaningful opportunities, build a positive work environment, and serve as a dependable resource for the workforce. She has been in this position for 3 years. Payton enjoys hiking, biking, and spending time with her 2 animals, Woody and Riley. Payton holds a master's in business administration from Southern Illinois University at Edwardsville. She's been a driving force and a key partner in an apprenticeship initiative that places disabled Collinsville high school students into apprenticeships with the city of Collinsville. And today she will be sharing the insights she has gained through that experience. Michelle Velez is a business employment consultant for the state of Illinois Division of Rehabilitation Services. Michelle is a veteran of the United States Air Force. She has experience in the private sector as well as the public sector. She's served in the last 14 years in various agencies with the state of Illinois. In addition to her work with rehabilitation services, she has worked and gained knowledge in child support, employment security, and financial and professional regulation. In her current position, Michelle conducts employer outreach and partners with employers to find out and assist with their workforce needs by sharing leads, providing direct referrals, and working together with WIOA workforce partners and community partners, connecting employers with partners and individuals seeking employment. For the past year and a half, Michelle's been working on a statewide apprenticeship project researching statewide apprenticeship programs to find out about all of the different programs that are available here in Illinois and to assist these employers with recruitment of individuals for their apprenticeship opportunities. Michelle, I'd like for you to get the conversation started by talking about your project. You spent a lot of time on the telephone with businesses and employers over the past number of months gathering information on apprenticeships that are available. Can you give us an idea of some of the more unusual or surprising apprenticeship opportunities you've uncovered?
Yeah, hi, Mike. So good morning, everybody. I do have quite a bit of information to share, but I talk pretty fast, so hopefully I'll get through it kind of quick. But yes, there's a variety of apprenticeship opportunities here in Illinois with both employers in the private and public sector, colleges and universities, high schools, and even correctional centers. Not only are there the union trades that most individuals tend to think of when hearing the word apprenticeship, such as cement mason, painters, plumbers, sprinkler fitters, elevator constructors, and stagehands, but there are also ICAT, which are Industry Consortium for Advanced Technical Training Programs, which are the leading apprenticeship programs for manufacturers and companies with complex administrative processes. They have programs in mechatronics technician, advanced manufacturing technician, pharmaceutical manufacturing technician, industrial electronics technician, and CNC machining. Some other non-traditional programs I've come across while doing my research in Illinois are in graphic arts, culinary, banking and finance, pharmacy technicians, cybersecurity, human resources, insurance, software development, networking, CDL truck driver, medical billing specialist, certified nursing assistant, certified medical assistant, psychiatric and mental health technicians, welding, water and wastewater operations specialist, building maintenance repair, firefighters, arborists, aircraft maintenance technicians, automotive technicians, bus and truck maintenance technicians, diagnostic imaging, heavy rail car repairer, surveyor and mapping technician, agricultural service worker, central sterile processing technician, merchant mariner, refinery operator, and child care development specialist. I recently connected with individuals from the correctional centers, which I thought was pretty interesting because I thought that apprenticeship opportunities at a correctional center may be for individuals such as like maybe mental health technician, but it was interesting because those apprenticeship opportunities that they have at the correctional centers are for individuals in custody, which I had never heard of. So I just wanted to share, I only got to reach out to 2, but there are several throughout the state that have programs. 2 that I reached out to, one was Illinois Rivers Correctional Center. They have 2 programs for individuals in custody. One is the Office Administrative Specialist and a baker. The other facility I reached out to and connected with was Hill Correctional Center. They have 4 programs. And these are also for individuals in custody. One is a meat butcher. Another is a dairy and juice technician. The third is the industrial maintenance mechanic. And the 4th is office manager / administrative services. I thought this was really interesting. And when I spoke with them, they indicated to me that they have these programs for individuals in custody. So they'll be successful in finding and obtaining employment once they're released. At this time, they have very few employer partnerships throughout the state with employers for their work release program. And they're very interested and would love to connect with other employers throughout the state to help hire individuals with certifications once they're released. So that's the information I have to share.
Thanks for that, Michelle.
You're welcome.
Just to add on or build a little bit on the correctional center conversation, I think it's a really important population sector that we need to pay attention to as we try to kind of close the skills gap and the labor gap that we all know exists. And the Kewanee Life Skills Reentry Center is another good example. And they do have outside employers that are sponsors for apprenticeship with them. There's a trailer manufacturer, I think called MTM Manufacturing, that hires welders. They have a day release program basically at Kewanee that is a really interesting model for that. So appreciate you bringing that up, Michelle. So healthcare apprenticeships are, I think, going to be one of the more one of the leaders in sort of non-traditional apprenticeships going forward, because of the fact that there are so many entry points into the field, and then so many different places to go, on ramps and off ramps once you're there. So Pete, let's talk about that in the context of pharmacy technician apprenticeships. Can you explain for us how you got involved in promoting apprenticeships as a solution for workforce issues in the pharmacy business, and perhaps give us a brief progress report on how that effort's going?
Thanks, Mike, and good morning, everybody. My journey into apprenticeship started about 6 years ago when I met Sherry Speakman from Talent First, who has a passion to help people that are from lesser economic areas, to help them, find fulfilling employment, but also employment that would have upward mobility and even get into a profession at a higher level. And we met, we engaged Jan Koretzis, who was an educator of pharmacy technicians for many years, and had a reputation in the state as being exceptional in doing so. We got together, we realized that there was a tremendous shortage of pharmacy technicians in all sectors, that independent pharmacists were having a hard time finding and keeping pharmacy technicians, that chain pharmacies were having a difficult time doing so, that hospital pharmacies were the target that we had, because there were better paying situations, there was upward mobility that was being built into their technician opportunities. They were expanding the role of the pharmacy technician in health systems. We gathered people, the directors from 16 different major hospitals in Chicago. And when we asked them what was their average, the number of technicians that they could hire right away if they could, and we laid out, I got more involved in this when, as the director of the accrediting body in pharmacy, I reached out to the American Society of Health System Pharmacists and said, because they had a accrediting group, and we said, rather than compete, why don't we work together and try and identify how to help get people accredited to do this. And we met with these directors. We explained that there were 2 levels of technician that came out of the ASHP, ACPE collaboration. One was an entry level that was targeted heavily towards outpatient work in a clinic or in a pharmacy of either a chain or an independent. And we said, okay, and we developed a curriculum that was 400 hours with both didactic and experiential education. But we also knew that the hospital people needed a higher level of training. And we developed an advanced technician that was 600 hours of training, both didactic and experiential. So again, we started out, and there was a lot of interest in the Chicago area. And this was, we had a meeting actually just before COVID hit. And COVID had a devastating effect on people's ability to hire, to, who was going to do what, how they were going to train people. And that went on for a couple of years, and it really impacted our ability to work with a group that was very interested in doing so. Mike, then we, Sherry and you connected, and we met and realized that there was opportunities in Southern Illinois where there was a great need for this. In addition to this, it's a long story, but there were some issues identified in a study that was done that made national press, that people were filling prescriptions that potentially had dangerous drug interactions, and they did so. It wound up in the Tribune in Chicago for many days, many weeks. It then also made USA Today, where this same issue was identified, and the legislature set up a task force to identify what needed to be done to, what was the cause of this. And some of it was just manpower issues, people trying to rush to do things, training issues, were we training technicians appropriately, with the end result that the law passed that said by the year X, which got now moved twice because of COVID, that by the year, actually now it's January of 2024, that technicians in Illinois would have to have graduated in an accredited program. And that led to us trying to work with educating the community colleges about what was going to happen, how they could partner with hospitals to create an on-ramping for pharmacy technicians. And we did that in various sectors in the state. But then we met Mike Conley, and Mike's job was to move in this arena. We shared what we knew. Mike shared what he knew. Mike has recently gotten funded for some work in this arena that he'll share with you. Essentially we're getting an uptake in the southern part of the state where the community college that Mike works for is now reaching out to 44 hospitals in the area. And we're helping to educate the hospitals and the accrediting requirements, which have now led to Mike's employer becoming, or shortly becoming, accredited. Mike, anything else you want me to share?
No, I appreciate that, Pete. The local workforce areas have been doing a lot of work on that as well, and they're sort of developing that consortium approach to healthcare apprenticeships. But I'm glad you brought up the credentialing, because that's one of the things that I think distinguishes healthcare apprenticeships with some others, in that they require, credentialing and training that's maybe beyond what it is. I mean, employers typically want to bring people into the workforce as quickly as possible. But healthcare is one of those where we have to sort of just follow the guidelines and make sure that people are certainly well-trained and qualified and have the necessary credentials before they enter into that field. Payton, there's a lot of energy and enthusiasm behind making the workforce a more equitable opportunity for populations that may have been shut out in the past, including people with disabilities. Those of us who advocate for apprenticeship look at it as a great strategy for leveling the playing field for non-traditional populations, because apprenticeship really strengthens the training component of workforce preparation. Can you explain some of the roles the students with disabilities have been able to fill for the city of Collinsville?
Yeah, so we have two different departments that are participating. We have our Gateway Convention Center, and then we also have our Parks and Rec department. Focusing on our Parks and Rec department right now, we have park maintenance workers. So they'll come right after school and they'll work till about 3 to 4 o'clock, depending on the day. They can expect to pick up trash bins. They have been able to do weed eating after a certain time. They can expect to do landscaping, shoveling, lining ball fields, and then in the winter time they'll be tasked with shoveling snow, which I think that's their favorite thing to do. They love being out in the cold. And then moving on to our convention center, we have 2 positions open that they can participate in, which is our housekeeping department and our event crew. Housekeeping is very basic, general housekeeping duties, dusting, mopping, vacuuming, and they clean glass, pick up empty trash bins, make sure during the events trash is picked up. And then we also have our event crew. So this is mainly our setup and tear down group. So they would set up tables and chairs, and they would also line, pipe, and drape up for the events. And then after the event is over, they would have to take down the pipe and drape, fold it in a Nisonite manner, and then put it back in its place to where it was supposed to be at. And Michelle was actually getting my wheels turning for a little bit here whenever she was talking about different apprenticeship programs and like the bookings area for correctionals. We have our police department who has civilian police aides, and they actually have to work with booking individuals. So that would maybe be something interested that we would be focusing on too. But I think the ultimate goal for us in this is to expand through all of our departments. That's my goal. I would hope that at least every single department, or at least majority of our departments, would have an apprenticeship working for them. I think that would really help bridge our labor gap there. And also, I think it would give our employees the confidence and more manager skills to help deal with those students and everything like that. So
just to kind of follow up on that a little bit, Payton, when you talk about, so like right now, I'm assuming that at Collinsville High School is your related training provider.
Correct.
So there's no cost to that.
Correct.
So as you guys begin to sort of expand that into some other career opportunities, have you thought about that and how you're going to do that? Because public sector, it's a little, delicate.
Yeah. And I mean, I think that's definitely the goal. I think this is our base right now to where this is our starting point. And we definitely want to expand into other opportunities where we can utilize those apprenticeship students.
So great. Thanks for that. So Pete, I'm fascinated by the possibilities that apprenticeship offers in allied health from a career pathways perspective, and the obvious linkages between, a pharmacy technician and a pharmacist. But can you talk a little bit about the relevance of pharmacy as a subject matter for training in other allied health fields, and maybe describe how a pharmacy technician might be able to leverage their training as an on-ramp for a related career?
Well, so technicians who work with pharmacists and know a lot about the drugs and then choose to say, well, I would like to do this as a career, they have, they have to meet the requirements for acceptance, but that can be facilitated because their experience is recognized as something that can be very beneficial to somebody. As I've done accrediting visits around the country, it's not uncommon to say, well, we have, 4, 5, 6 students who were pharmacy technicians and who've now matriculated into the pharmacy program. And it is, it's not impossible. It's actually something that the schools put as a positive in somebody's application if they've had, longstanding experience and come into the program with that background. The other thing we've explored with Mike, and I think Sherry and you have spoken, that right now, if you say to somebody, who is in the health field that people are interested in apprenticeships, they'll talk about shortages of CNA and CMAs, and the question is there a way that you can take a CMA and add to it a pharmacy technician education of some sort as part of the apprenticeship? So now you have somebody who's got double skills and can fill in and do different things and could be more we're exploring this, but we think they could be more useful in the field if they had both backgrounds and be able to help in different areas. So, so yeah, and the other thing that's occurring is pharmacy technicians are in need, but they're also getting more and more responsibility, which is drawing a higher salary for what they do. And they're more involved with the patients and working with the pharmacists, especially in the hospital environments, to try and give them a career ladder and things that would allow for better retention, because turnover has always been a big problem as people hunted for, higher paying jobs of one sort or another. But right now there's national shortage, but increasing opportunities and responsibilities, which then translates into higher salaries and opportunities that would lead to greater retention, both for the technicians and for the employers.
So can you give us an idea, Pete, what some of the maybe the differences between hospital and retail pharmacies are in terms of both demand for pharmacy techs, and then also the differences in duties and responsibilities that they might have? So how, and you talked a little bit about setting up apprenticeship models that address both of those. Maybe in that context, what is it that this greater value is bringing in higher wages? And that's kind of an interesting concept that we sort of look at a lot of times. When we're looking at demand, what is the wage? Is it a living wage and things like that? But we don't often think of it in terms of, let's make this a more value added profession that is going to be worth a higher wage at some point. So I think that's an interesting point there.
Yeah, well, they're in the community arena, the technicians need to be involved, or need to be well trained to be involved in prescription preparation for checking by the pharmacist and other activities. But in many states right now, excuse me, in many states right now, technicians are with appropriate training are being involved in vaccinations. And many of you have gotten your COVID vaccines in a pharmacy. I don't know if people appreciate that 70% of the COVID vaccinations have been given in pharmacies. And that's now growing in terms of other things that are in need besides COVID. And there's other vaccinations that are also available in pharmacies. And again, technicians in various states are expanding and being involved in this. Pharmacists are expanding what they do more from the prescription itself, but rather how are the patients responding to the drug? How do they avoid drug interactions that could be harmful? How do they know when to call their doctor if they find the patient having, some issues? So it's called clinical pharmacy. It's not about the drug, it's about the patients and how to use the drugs and how to communicate that effectively and get the best outcomes out of the therapy. And so that's something that the pharmacists need more help from the technicians for, what can the technicians do to help me do what I'm doing on this other end? And it raises the level of activity and opportunities for the technicians. And it also helps patient care, both in the ambulatory area as well as in the inpatient area and in the clinic area.
All right, thanks for that, Pete. So, I mean, the theme to me that emerges is what I feel like is the most valuable aspect of apprenticeship, and that's that it takes marginalized populations like the disabled, both cognitively and physically disabled, second chance populations, people, prisoners who are being released into society and need to be become productive members of society, economically disadvantaged populations. And again, it's like a great equalizer, basically. So Payton, if you could kind of speak to this a little bit, populations that have typically been provided fewer workforce opportunities, they may need additional support as they work their way through training. That speaks to pre-apprenticeship and those sorts of things. And so this requires really strong partnerships, because there's different agencies or entities that may be responsible for different aspects of that training. So can you give us some kind of insights into the kind of organizations who've been involved in the Collinsville initiative, and how those relationships strengthen and improve outcomes, and how you go about making sure that those partnerships kind of hold together as time goes on?
Yeah, and definitely partnerships have definitely been the key to this program. Madison County has reached out to us regarding the program, told us what it was all about and how we can accomplish this. We partnered with Collinsville High School, and they have a STEP program who also facilitated helping working with the disabled students, making sure that they have all the job required training, and they follow up with them just to make sure whenever the students are at the job, they're doing their task. They're making sure that they're showing up to work on time, and they'll also bring up any concerns that they have with the students too. I feel without these partnerships, we probably wouldn't be where we are today without it. For example, during our first program, we didn't really have a lot of staff who were trained to handle disabled students. But Madison County came right in and said, we have this job coach program. You can train all of your staff for free. So all of our staff that trains the apprenticeship students, they're all certified job coaches. And I feel without that partnership, we wouldn't be able to accomplish that at all.
That's great. You have one of your apprentices is graduating today, is that
Yep.
correct?
He is graduating in January, so it's very close. Yep. So we definitely expect him to graduate, and we're really excited for him to graduate and be a full employee finally with the city. So we're excited for him.
And just as a reminder, everybody that's watching, of course, he's going to have that apprenticeship completion credential that he'll be able to carry with him if he moves to a different job and in the same field. He'll be able to show some certification that he has the credentials and the skills that are necessary to perform that job. Michelle, can you give us some kind of an idea what employers are telling you about their experiences with apprenticeship? And I don't want this to be just like all happy, joy. If there are difficulties that they're having or challenges that they're facing, I certainly would like for us to address those as well. Are there things that we can do as advocates for apprenticeship that would better support employers as they try to make this work? Is the idea of apprenticeship attractive to job seekers? How are employers promoting their own apprenticeships? And then how can we do a better job as a workforce system to connect, job seekers to those opportunities?
Okay, that was a few.
One there.
That was a few questions, so I'll try to remember all of them to answer. Okay, so regarding the employers that I've connected with, obviously there's over 500 registered apprenticeship programs in the state of Illinois, and I've only probably connected with maybe about 100 of those, employers. But a couple that come to mind, one is Alton Fire Department. When I connected with them, they told me that their program is now inactive. And they said it has been for like about 10 years now, and that was due to staff reductions. Another that I connected with that I recall, they had graphic installer positions, and they said they were having a hard time recruiting and finding individuals for their program. So they, discontinued their program. I want to say about 5 of the 100 were inactive. One employer did tell me that he was not interested in, since we're keeping it real here, that he was not interested in doing the apprenticeship program anymore. And he said that was because he was frustrated because he said he had about 3 apprentices and all 3 left shortly after obtaining their certification to go somewhere else for higher pay. So he was the only one that I've spoke with, and that told me, you know, anything that was a little bit negative. I wasn't expecting that, but you know, I mean, it's happening pretty much now everywhere. I've noticed, you know, with individuals kind of going somewhere where there's maybe better benefits, higher pay. I'm sorry, what was another one of your questions you were asking me? Sorry.
Basically, what can we do? I mean, the problems that you've identified there, what do you feel like are solutions for those? Or how do we go about trying to do a better job of recruiting? Are we leaving the employers out there on their own to recruit to these positions, or is there a role for other workforce partners in that?
Okay, so yeah, so I do always ask the employers when I meet with them if they are aware of WIOA and if they're working with their local workforce center or American Job Center. Quite a few have told me, I want to say maybe 80% have told me that they are working with a representative from their local workforce, and the others told me they didn't know anyone through their local workforce, never heard of it, and you know, were interested in meeting with other workforce partners of mine. So what I do is I go ahead and do e-introductions for them to meet veterans officers that I work with in the state, or I'll connect them with colleagues to connect them with some of their workforce partners, because the offices that I'm assigned to, obviously I'm doing this statewide apprenticeship project, but I'm not assigned to all of our agency offices throughout the state. So I have a team of colleagues that are assigned to different areas. So I'll usually, you know, share information with them. Some employers have mentioned to me that they're interested in starting more programs, or it needs some more assistance with funding or finding out more information. So I do work pretty closely with the state apprenticeship navigators. I would go ahead usually and do an e-introduction and connect them with a state apprenticeship navigator to assist them. So that's more about how I go about trying to assist the employers. Anything that they need, I just let them know. I'll assist with sharing the opportunities that they have, whether it's an apprenticeship opportunity or not. I still go ahead and help them with sharing their workforce needs. You know, and that's why I'm here. I love what I do, and I'm here just to try to help others learn the same as I am about all these programs.
Yeah, and I think it's important that we can't just you know, promote apprenticeship for the sake of apprenticeship. We have to promote it because it's a mechanism to sort of solve some of the workforce problems or workforce issues that we have. And I mean, one of the kind of guiding forces for me in the work that I do every day is a study that I saw a couple of years ago from MC, which many people may be aware of. Is sort of a workforce analytics company. And they did a study on really just US population trends, and the demographic drought is what the topic of the conversation was. And it basically pointed out that we just don't, I mean, as baby boomers age out of the workforce system, and we don't have, you know, the same numbers of people replacing them, as the pandemic has caused people to go into early retirement. We have a lower, more complicated sociological phenomenon, but the birth replacement rate has been below what it needs to be to maintain sort of a level population for 3 or 4 decades now. So we just generally have a shrinking population, but we have an expanding workforce. So all those baby boomers who made a bunch of money while they were in the workforce and are now aging out of it are still buying things. So we still have a need to, you know, to produce the things that they want to buy. And how are we going to do that? You know, and I think that one of the answers is, I don't know that it's, I don't know that there's a final solution for the problems that ail us, but some of the things that we can do to mitigate it are bringing people who are on the sidelines right now back into the workforce. And we see unemployment rates of 4.5% or 5%. But when you look at it from a labor participation rate perspective, we really, the inverse of the labor participation rate is anywhere from 30 to 35%. And we've got to bring those people off the sidelines and into the workforce. It's going to solve a lot of problems for society, and also for them personally. And I mean, I think in my mind, apprenticeship is a very egalitarian system in that sense. It provides the opportunity for a debt-free education and training for the apprentice, and it provides a talent pipeline possibility for employers. But we all have to figure out a way to sort of bring that all together, and bring it to bear in the workforce. And it's not without its challenges. And I think it's, not okay to just paint a happy face on it and say, this is how we're going to do it. But we all have to kind of constantly and continually be striving for those solutions. And with that said, Payton, so I want to go back a little bit and ask you to maybe amplify your answer about you guys expanding into more occupations for your apprenticeship program, and how that educational piece is going to be paid for. So whether you're using in these other fields, whether you're using a community college or a private training provider, or utilizing contract training or whatever, is there support among elected officials and among the public for expending tax dollars on educational initiatives, or do you have ideas about how you guys might be able to sort of broker that?
I think right now we kind of are in the like idea phase, brainstorming phase of things. We're definitely looking at different community colleges and reaching out to them. However, we just haven't got that far at that point. So it's definitely something that is a growing interest, especially for us. I think that it adds so much value to our organization and our team and our staff. It just gives them so much confidence to manage these employees. So we're definitely going to be looking at local colleges and then going from there.
And so Michelle talked about the shuttered program in the fire department. On the flip side of that, I think we've heard some success stories about EMS agencies and fire departments and police departments even, who are utilizing apprenticeship in order to try to fill those really critical
and that's a great role right now, especially with those two departments. We're going through our different lists right now, our hiring processes, and the labor market is very, very slim there. So any way to help in odds and ends types of things, that would be really great for us to utilize those students or those apprenticeship programs for that.
Right. So I'm out of questions. But I don't know, Tanner, if there are any that have come from the audience, or if not questions, even additional information that might be interesting to share with the group.
Yeah, there was a couple comments. Victor said educating employers that apprenticeships bring value to their company and should increase profits. Hence, they should increase wages to keep the talent.
Very good point. I think that's a message we have to communicate. Another one also is that WIOA does exist, and that provides some assistance with that education training in particular. We've got an awareness problem, in terms of WIOA. A lot of employers, as Michelle mentioned, just don't know that it even exists. It's maybe one of the more underutilized and potentially valuable programs that are out there, in my mind. So I would encourage any employers who are on here to sort of look up your local workforce area, find out the programs that they have available, not only education, but as Payton talked about, the job coaching program, on the job training opportunities for upskilling, whether that's an apprenticeship or some other opportunity. So I think it's really critical that we take the strengths of both the public sector and the private sector, and we try to utilize them in a way that complements one another rather than competing with each other. And this really needs to be a partnership between public and private sector. And I think that finding those grant funding opportunities is a good way to do it. The grant that we have that Pete mentioned is part of the JTED program that some people may be familiar with. It's probably a one shot because it was funded through ARPA, but job training and economic development. And ours specifically here is related to healthcare apprenticeships, and just really an apprenticeship accelerator idea that we're going to just basically pay employers for taking a crack at apprenticeship, that they can use it for wages, to offset those wages, to use for onboarding expenses and things like that. And the idea is not that it's going to be a sort of permanent subsidy for the private sector or for employers, but that it's something that will persuade some of them to try it, and hopefully be a proof of concept that will encourage them to make that investment themselves going forward. I see Mindy has asked for emails. I'm going to just go ahead and type mine in the chat, and if the other panelists would do likewise. That may be helpful to some people. I'm happy to, I don't know all the answers, but I'm happy to try to find someone who does if I don't know them. Any other questions from anyone who's on board, or any just a comment that anyone has about apprenticeship in general, or pluses or minuses?
Mike. Oh, I was just gonna share something, Mike, if that's okay.
Absolutely.
So I'm just moving over to another screen real quick, but since we were talking about pharmacy tech positions, I just wanted to share with everyone, in case some people don't know, that CVS Pharmacy, actually their distribution center in Mount Prospect, it's a little bit different the way their pharmacy tech program works. So they have their in-house pharmacy tech program, and individuals there could actually work in call center roles and distribution center roles. So it's a little bit different from actually, you know, working in a pharmacy such as Walgreens, and people drive up or come in for prescriptions. The positions they have for the call center, it's a pharmacy service representative. So it'd be like an inbound call center position where customers would call in for information on the status of their prescriptions, to request refills, etc. And in their distribution center roles, they have pharmacy techs that are actually dispensing, doing shipping, working with materials. They have the clerk positions, automation, mechanic dispensing positions, the canister technicians, and warehouse clerks. So individuals can actually even just come in as a warehouse clerk and then move up into a position as a pharmacy tech, and they could do the in-house training program there. And after working on site at that location for a minimum of a year, they can request a transfer to work at a CVS pharmacy close to their home. So I just thought it was a little bit interesting and wanted to share that, since Pete was talking before about, you know, pharmacy positions and working in the pharmacy and hospitals. And it was just a little bit different. So I wanted to share that information with everyone.
Yeah. Thank you, Michelle. I mean, in addition to that, you know, Walgreens, for example, has a pretty robust program for persons with disabilities to work in their warehouse distribution settings as well. So I'm sorry, Pete, did you have a comment there?
No, just to follow up, if you go into the Walgreens in Glen Ellen, where I live, there's a big sign saying, you know, we have openings for apprentices, and if you want to, you know, come join us. So they understand that it's a way to, you know, gather people that they can train and then develop into their business model in various ways. You know, a lot of technicians do things like inventory control and all kinds of things that, you know, they show capabilities. Mike, I underserved the hospital market when you asked me the difference between a community apprentice and a hospital-based apprentice. But I wanted to tell you a little bit about the marketplace a little bit further. The American Society of Health System Pharmacists did a survey of pharmacy administrators late last year. And here are some of the numbers. The majority of the administrators reported turnover rates of at least 20 to 30%. Nearly 1 in 10 have lost 41% or more of their pharmacy technicians. And nearly all health system pharmacy administrators reported increasing use of overtime to fill shifts. And nearly 9 out of 10 reported using pharmacists to fill pharmacy technician shifts or perform technician activities. And the average vacancy rate for inpatient FTE technician positions is 22%. And the average vacancy rate for ambulatory positions is 21%. So The idea here is the market is in great need and they're responding the way you would think. They're trying to pay more. They're trying to look at new models. They're hungry for identifying people. And what's happening now is that when we went out initially and we started asking people, they would say, well, where's the money coming from for this? And now a major hospital in Chicago decided they want to work with their community, identify disadvantaged students, and pay to have them so that they're not paying headhunters to find them people. It's very expensive. And they work out these pipelines between, hopefully with the community colleges graduating, students who have been through an accredited program, or make that part of the apprenticeship, make it the required instruction as part of the apprenticeship. And financially, you're going to see more and more hospitals investing in the apprenticeship without asking for, what money are you going to give me to do this? We need these people and we're going to pay to do it a different way called apprenticeship.
Right. And it brings up a couple of statistics that I probably should have mentioned earlier, Pete, but these are two areas that apprenticeship really directly addresses, retention being one of them. And the statistics from the Department of Labor are that more than 90% of apprentices stay in that job once they've completed their apprenticeship program. And then the number fluctuates a little bit, but the return on investment for apprenticeship, and this is even absent any government subsidy or assistance, is somewhere close to $1.50 for every dollar that's invested in it. So the idea of employers paying for it is almost misguided, because in theory, they should be getting a return on that investment as well. It should be an investment rather than a cost, as the way we frame that.
It's the fact that they're doing it themselves, they understand the benefit, they understand the investment and the return.
Right. So Kim Kuchenbrod is on the line with us today, and I'm glad to have her with us today. Kim is sort of the Illinois apprenticeship guru and talent pipeline management guru. And I think she has a comment that she might like to make in the context of what we're talking about.
Thank you, Mike.
Sure.
I just really wanted to, I love the conversation today. And when we're talking about those non-traditional apprenticeship opportunities, in the past, we've always thought and referred to apprenticeships, we automatically thought construction and the trades, and that's okay. But when we're starting to talk non-traditional, I want everyone here today to know that there isn't a position out there today that cannot be added to an apprenticeship training program. Across Illinois right now, we are looking in some areas such as equine management with a new program that will probably be modeling after the state of Kentucky, where they're working with individuals who are re-entering the workforce. We also are looking at electrical vehicle positions. We're looking at wastewater operation positions, education, culinary arts, cosmetology, barbering, you name it, we are putting those into an apprenticeship training program. The key components that we need, number one, is a business who wants to establish that apprenticeship training program. Two, a training provider that's willing to work with us to establish those. And of course, as everyone has said, the willing candidate to go through a training program. I heard Pete's comment just a few minutes ago about how do we engage with the students and how do we make them part of the process? Well, one of the ways that we can do that is what I call building a value stream. And that value stream is how do we combine the suppliers and the employers and find that happy medium between both entities, but more importantly, to benefit the learner. And I really think we need to go down into the high school level. So when you think about that high school student, there are a couple of pathways that they're looking at. They're looking at that 4-year track, and many of them have been looking at that. But what about that percentage percentage of students who aren't sure what they want to do. They're not for sure if they want to go that 4-year track or that 2-year track, but they want something. And the statistics always show that you need some level of post-secondary training, but not necessarily that higher degree. So if we tie apprenticeship training programs, which we already are with youth apprenticeships or pre-apprenticeships, where the individual is getting that extra support so they can go into a registered training program. But if we look further in that value stream of how do we tie our career and tech ed programs to those youth apprenticeship training programs so that the students honestly, they can see it, touch it, feel it, taste it, and find out if really this is the career pathway that they want to explore before making that big decision after high school. And if one of those students who says, you know, I don't want to go that 2-year or 4-year track, then it gives them a pathway to consider, and that's through a registered apprenticeship training program. And many of the registered apprenticeship training programs are tied to dual credit when they are a high school student. So even when that student's thinking, I don't think I want to go to college, and they're in a career and tech ed program that is tied to an apprenticeship, they're already earning college credit that can be applied to a certificate program and or an associate's degree. When they come out of the registered apprenticeship training program, many of them are so close to that associate's degree anyway, that the employer will still help them complete that associate's degree as a benefit to the employee. And now, when you were talking about the ROI, yes, there is a financial ROI, but sometimes there is a human ROI because you're taking the apprentice and you're tying them to a career mentor within that or a career coach. And sometimes you really can't put a price on that ROI because now that mentor feels like they are making a difference for their employer. And of course, then you end up with longer sustainability and you decrease that turnover rate, increasing your retention rate from the employer's perspective. But now that mentor feels engaged. Then the last point I want to make is we've talked a lot about how do we get an individual into an apprenticeship training program, but apprenticeships can also be used for upskilling your current staff. If you have an individual who is ready, or you're getting ready to hire for that frontline manager, or maybe that middle manager position, why look outside elsewhere? Why not look internally to see if there is a candidate with a little extra support through an apprenticeship training program you can upskill right there in-house, reducing the headhunter costs, reducing the marketing and looking for that individual from an outside. And again, your ROI increases because now that employee sees that the employer is investing in them, and more than likely that employee is going to in return invest in the company and in that position. The last comment I really do want to make is, as all of you are sitting here today, you know, do not remove the silos, remove the blinders, and look at what are the opportunities and how can we use them for apprenticeships across all sectors and all positions, but also look at those untapped talent pools that for many reasons we have not looked at in the past. Whether we are looking with individuals who have disabilities, whether the individual is re-entering the workforce, or a veteran, or maybe someone that's in the senior citizen age that has decided to re-engage with the workforce. The comment made earlier was, you know, and maybe it was on yesterday's webinar, it's not a people shortage, it's a skill shortage. And if we can use apprenticeships to help curb or start to eliminate that, then all the better. Thank you, Mike.
Sure, Kim, thank you. I appreciate your expertise and for sort of, I think, summing up our discussion very well there as we come to a close here. And talking about that, the fact that apprenticeships are not, I mean, what businesses typically tend to do is start trying to find skills or find talent And they need to really concentrate. I feel like an apprenticeship is a great mechanism for doing that, in building their own talent and developing talent instead of just trying to go out and steal it from someone who's in the same employment sector as they are. If we can create a talent pool that's larger, that's going to benefit everyone, I believe. With that, we're at 10 o'clock at time. I want to really thank my panelists today. I think we had a really robust and provocative discussion, and I appreciate all your participation in it. And thanks to everyone who joined in. We have 3 webinars remaining this week, so if you haven't signed up for those yet, please do so. Tomorrow, the subject is going to be training mentors for apprenticeship. On Thursday, it'll be employer boot camp. In other words, sort of maybe a playbook for employers and how to set up an apprenticeship program or how to make sure that one is successful. And then on Friday, one of my favorite topics is to actually see some apprentices and hear their stories and what their experience has been with the apprenticeship framework. Check out apprenticeshipillinois.com for more information about apprenticeship in general. And also, please stay involved with our social media. The Apprenticeship Illinois Committee has an account on Twitter, Facebook, LinkedIn, and Instagram. Appreciate all of you following or whatever it is we do with those social media companies that I don't quite understand. But thanks to everyone for joining us today, and look forward to seeing you on the calls the rest of the week.